Okay, thank you everyone for joining today's webinar on transportation and the post-COVID-19 transportation map. Just to let everyone know, everyone's mics are muted today. That's to avoid any background noise for our presenters. And we will be recording today's session and it will be available to you in the coming days. And with that said, I will hand things over to Shaylin Batt, President and CEO of ITS America.
Thank you so much, Rachel. Hopefully everyone can see me and my video is working. So the official title of our webinar today is Technology in the Post-COVID-19 Transportation Roadmap. I've been calling it Big Brains in Transportation and Me because today we're going to be joined by some really interesting and dynamic folks from around the research sphere. You know, we've got all kinds of implications from, you know, on transportation. Because of COVID-19, there's a lot of unrest in our cities and different places around the country right now, and equity and transportation plays a huge role. And so whether it is the impacts on new mobility options, the importance of transit, automated vehicles, climate impacts, because I think that's a really critical piece of transportation and the nexus with infrastructure and transportation. There's a lot that we really need to be considering. So today we're going to be joined by Greg Winfrey from Texas A&M, Susan Shaheen from UC Berkeley, Stan Caldwell from CMU, and Huei Peng from the University of Michigan. He's got a great picture of MCity behind him there. So I guess we'll just jump right in. If you have questions, you can ask them through the chat function. We actually received a bunch of questions beforehand, and I'll try to weave those in. But you know, I'm going to start with Greg Winfrey, who Greg and I were both Obama appointees at USDOT and had a lot of great conversations over the year. And I'll start with Greg, but open up to any of our panelists. You know, I think one of the challenges right now is we have transportation leaders around the country, state leaders, city leaders, transit operators who are, you know, looking at this and trying to make sense of things. We always want to make data-driven decisions in transportation. And so, Greg, I guess my question to you and others is, what data should decision makers be looking at right now, and how do we factor it into some of the decisions we're making?
Well, Shaylin, I can tell you at TTI, we developed a demonstration model to simulate infections due to person-to-person and person-to-vehicle interactions. It uses a synthetic population where people can have interactions with vehicles and with each other. Policies that can be tested in this demonstration model include social distancing, shelter in place, disinfection of public transportation vehicles, frequency of public transportation services, occupancy rates in public transport vehicles, et cetera. So we plan on using this modeling platform to expand to a real test case as a city or a region. And the reason I mention that is as we look at data writ large, we have to look backwards and cast backwards as to what we learned in the COVID scenario in prior pandemics and play it forward. We have a bad habit in this country of dealing with an issue in the immediate term, and then we have, you know, national amnesia and always get caught by surprise by things that are predictable or foreseeable. So what we're trying to do is capture what we know now and spread the learnings so that cities, regions, et cetera, don't make the same mistakes and get us in a situation where we are now. Because one of the things we know is this ain't the last pandemic we're going to be dealing with, right? And climatologists and others say they're going to increase in frequency. I'm not going to make that part of the discussion, but we know that this isn't the last pandemic we'll deal with. So we need to learn what we can, move it forward, improve the transportation system, which is the circulatory system of our economy and of our nation. But that's kind of what we're looking at here at TTI.
Yeah, no, that's. I think it is really important for us to understand that there is broad consensus that infectious diseases and the vectors that bring them into our society will only increase, and I think that that is incredibly important for us to not just respond to COVID as a one-time event and then be like, okay, we did that, and now move forward. I think one piece of data I think that has really jumped out at us at ITS America, and I think frankly across the world, is the impact to transit and how transit usage is down by 75% to 90%. There are real concerns around how we do that. And I know Stan or others, or even Greg, if you want to jump back in, I think that, one of the things that we're really concerned about is that we don't go back to this world before where everybody was like, let's just drive alone in our vehicle. So what can we do from a data standpoint or a technology standpoint to make sure that transit is safe and people feel like a good option for them to take going forward?
I think the concern with transit is currently the fact that we know that there were a lot of choice riders, people that had the choice of taking transit or driving their own vehicles or taking another mode of transportation. And those choice riders, they're the ones who dropped off precipitously. And the ones left are our kind of frontline heroes that are taking transit because it's their only option, but they're also the ones that are out there keeping our stores open and keeping our operations running, and they're our frontline workers. So we're seeing a kind of a great disparity of, majority of the people dropping off, but the need for those to provide that critical service to the folks that are out there. And I think back to the first question as well, we've done a good job over the last 10 years of real-time data and predictive data and a lot of our models, but it's around systems. We have public and private data, multimodal and multi-jurisdictional data, but I think what this situation has taught us is that we need to be having the data on the human behavior, because until we are changing people's behavior and understanding how systems change people's behavior, that's where the real disruption happens.
Yeah, Sid, I think you make a great point, which is we always love our data, but we tend to view the data from our own silo within transportation, whether it's passenger and data on transit, or how many cars and trucks per day are on a road, or there's freight implications. I think what you're saying is it's got to be more integrated, more system-wide approaches to it. And I also think you raise a good point from an equity standpoint. From my experience running transit in the United States, too often we provide transit as an option of last resort for people. And those choice riders, we need to be able to keep them, because transit cannot be viewed as an option of last resort. Otherwise, we're going to end up with folks just driving in their cars, and that's clearly not a good outcome. Susan, we've had a lot of conversations. You've been I hate to use the word pioneer for folks who are still living, because it implies that you've been around for a very long time, but maybe leading edge thinker is a better way to put it. But, I think the impacts of transportation, I mean, we've known for a long time that about 28% of greenhouse gas emissions come from the transportation sector. And one, I think, very faint silver lining around this COVID-19 experience has been, we've seen, some improved air quality in places where traffic has come down, but we still know freight's an impact. Either from a data perspective or a technology perspective, what are you thinking about at UC Berkeley on how we maintain some of the mobility benefits, weave in that climate impact, and continue to see good outcomes?
All right. Yeah, I love that question, Shailene. So we're really excited about what we're hearing in terms of reduction in, for example, carbon dioxide emissions. And I've shared with you that the World Meteorological Organization has predicted a 6 percentage point drop in carbon emissions in the year 2020, which is not too far away from what would be needed if we were keeping up with the the Paris Agreement on an annual basis. It's just less than 2 percentage points off from that. So at Berkeley, we've been thinking a lot about how do we preserve these benefits? And I think we really do need to think about consumers and their behavior, and also their trust in getting back into a shared vehicle, if that's a public transit vehicle, if it's a car sharing vehicle, if it's a Uber or Lyft vehicle, or even getting on a shared bike or a shared scooter. And I think the opportunity that I see for us right now is to move us, and I know this is something your organization is really interested in, is mobility on demand, right? Mm-hmm. I think one of the barriers to that type of approach is the fact that we don't have seamless routing, booking, and payment options. And I think maybe the silver lining that we could see here is maybe a push to create more seamless integrated payment systems that could make this a lot easier for people, and also provide more transparency in terms of trade-offs, in terms of travel time, travel costs, wait times. We do a lot of research on wait times and how that affects a person's desire to wait for a shared vehicle or a transit vehicle. So how can we make that experience more customer-centric? I also think that we've got a lot of opportunities to look at technologies to emphasize hygiene and sanitation. We're seeing a lot of discussion about ultraviolet light technology, nanotechnology to put on handlebars of scooters or bikes to help clean them. We've recently seen the example of Ford Motor Company using software on police vehicles to allow the vehicles to lock and heat the vehicles to a temperature of, I think it's around, 130 degrees Fahrenheit, to help sanitize the interior of the vehicle surfaces. So I think technologically there's a lot of opportunities. And before I conclude my remarks, because I know they've been a bit on the longer side, it's just such an exciting thing to talk about. I think we should also think really carefully about what's happening with telework. For a long time, that has been very elusive, right, as a tool to reduce vehicle miles traveled and emissions. But I think we might be seeing a moment here where we can think carefully about how to incentivize that, how to make it work better, and how to align that with congestion and environmental and sustainability and equity goals.
Yeah, I mean, Susan, no need to apologize. I think that your passion and enthusiasm really shines through. A couple things. I mean, you used a really important word, which is trust. Because in the absence of trust, we can say all that we want to do, but people are going to act in their own self-interest, which is natural. But we need to establish that trust. You also mentioned the Paris Accord. I would never have dreamed that in 2020 we would hit or come close to hitting the carbon reduction that was needed there. But again, the law of unintended consequences. And I'm going to come back to this concept of trust and technology, because I think, from a mobility standpoint and other things, as many of us contemplate this second wave and what happens in the fall, contact tracing has come up as a important way that we deal with some of these issues. And we may need to understand who's been on those scooters and where they've gone and some of the shared bike stuff. So we'll come back to that. And also, this concept of mobility as a right, and Jennifer Cohen, who's our chair, talks about this mobility as a right and how people need to get around, and we'll come back and weave that in. Huei, when my wife is from Michigan, and whenever we go back there, we spend a lot of time in the car because it's the car capital of America. And I know you've got a lot of great stuff going on in Ann Arbor and other places, but the fact of the matter is transit works really well in some places that have density, and in other places, it's not as easy to just jump on a bus or jump on transit. If a bunch of people get back in their vehicles, what are some of the technology options we can be looking at, or things you're thinking about at the University of Michigan to help manage traffic a little better there?
So thank you, Sharon. I think the idea is that COVID-19's impact is very significant People have a natural tendency to avoid using public or shared transportation modes. But the idea is that we need to use technology and design a better system so that it has a more sustainable, equitable solution. So I don't think car companies or members of MCity are just thinking about people going back to individual cars. As a matter of fact, I have seen a lot of different companies jump into action on technologies or systems, and they can be classified roughly into three categories: avoid exposure, reduce transmission, and become more efficient. So let me elaborate on that. We know that people are doing more work from home or telecommuting, and people are using more goods delivery. So obviously there are some AV, but more on the goods rather than people moving technology solution. But there are others, right? So we are seeing that people are shifting in the mobility modes. Also, people are moving into more contactless solutions. For example, just first I'll give an advertisement of MCity, right? Right now you can come to MCity doing testing without ever touching a button. So everything has been automated. You enter the gate, you control the traffic signal, camera, and so forth. Everything using your smartphone. And that is probably a model for the future city. So pedestrian or cyclist doesn't need to touch a button and they can trigger a traffic signal. Things like that, or payment, right? So contactless payment, contactless intersections, and so on and so forth. So these are all related to the avoid solution. The second category is reduced transmission, right? So like Susan already mentioned, coating or spray on disinfection, treatment of material, metal or fabric, UV disinfection, or in the future, some kind of more partitioned public share mobility is important. And the third category I think is even more important is we need to be more efficient. We know that COVID-19 means a huge reduction in the funding for public, say US DOT or state DOT and so on and so forth. So that means trouble. We will have perhaps less resource to work on, and we need to be more efficient. So having empty big buses running around may not be the best use of the very limited resource. And we need to really think about data model communication and informing, transparent and informed on-demand solution going forward. So these are the three categories that I see companies are working on: avoid, reduce, and efficient.
Shannon,
Yeah, no.
follow up on Huei.
Yeah.
We're in complete agreement about hardening transportation assets against the potential for the transmission of disease. You know, we look at transportation as a disease vector. So we know that moving infected humans from point A to point B spreads disease. We know that if you move infected insects, fruits, or other goods, you can pass disease. But what hasn't been focused on are the contact points where humans, particularly in a transit situation, touch a surface, and then 2 minutes later, someone gets behind them, touches the same spot, and then touches the mucous membrane, and now they're dealing with the spread of pathogens. So as we know, it's invisible. So hardening the assets has to be a key consideration, and I would submit that we need to look forward as well as we look back. So, and we need to be cross-disciplinary. So we need to visit with material scientists, health science experts, epidemiologists on the front end about new materials that can substitute what we know transmits pathogens, and that's stainless steel and plastic, meaning fiberglass, which are the principal materials of construction in public transit. But we also need to backcast, because if you go to any school that's got some history to it, all of the doorknobs are brass, all of the stairways, any touch points are brass. And that's because copper is identified as a strong antimicrobial, right? So we have technology now that was used prior to 1932 when antibiotics came to the fore and pushed materials to the side that we can reinvigorate and use in the near term while we're working on future solutions simultaneously.
Yes, so I agree. I think people are working on nanoparticle, not a pure copper
Yeah.
solution, but a nano copper particle that will release ion to be effective and less costly.
Yeah.
So
Yeah. So really good discussion point on the touch points. I also think there's a HVAC or respiratory component here as well between what we touch and versus what we breathe.
mhm.
I think that Greg, you raise a good point about looking back as well as looking forward. There's been a lot of discussion in the academic world and in transportation about autonomous vehicles, and I think there was a sense that we were just around the corner. AVs were just around the corner, and then obviously we had the tragedy in Tempe that set things back. But I would say that throughout COVID-19, whether it's Jacksonville using autonomous vehicles to ship medical supplies, or different cities enabling delivery by autonomous vehicles, I think there's been another shift in public perception, and I just wanted to get your perspective on, from a research perspective, what this means on the AV front for a technology that might have been on the back burner, and is it pushing to the front burner again?
That's a great question, Shaylin. And the way I've been parsing it, my background as a lawyer, so words are important. But I look at robots and automated technology going forward being a solution for, if you look at the infection rates amongst those workers who are working close together in meatpacking plants, robotics can take some of that burden and ensure social distancing. So robots are here, right? And my distinction is robots are automated vehicles that don't have human passengers. Automated vehicles, just to contrast it, would have human occupants. That's the technology that's been slowed. I think we're going to continue to see AI march forward. We're going to continue to see smart conveyances, but it's going to take some time to build the confidence back up in automated vehicles and find what that niche is, because we still have the issue with respect to pathogen transmission. Even if you get out of the car on the right side and I get in on the left side, there's still touch points that we have to address. So this falls within what Huei was saying, where auto manufacturers, whether or not it's human driven or automated, we need to be looking forward and how to reduce transmission and ensure the safety of the occupants.
Well, Greg, if I get in on the right side of the vehicle and you get in on the left side, that's a lot of touch point right there, because we both take a lot of space. So, yeah.
I think there's we have seen some applications on the freight side as well. I mean, at Carnegie Mellon, it's kind of ironic that the first autonomous vehicle we had was after a disaster, the 1979 3 Mile Island nuclear meltdown.
Yep.
First autonomous vehicle deployed was to go into there where it was not safe for humans, and now we're starting to see some pilot applications of transferring tests or cleansing roadways, worldwide, where we're seeing applications of automated vehicles doing things to either protect the drivers or protect the other humans from having to handle risky items. So I think there are applications, and I think we've been seeing that through all deployments of automated vehicles. Automated vehicles are very good at doing things that humans can't do. For instance, doing repetitive tasks over and over again without getting bored. But humans are always superior to machines in applying common sense to a situation they've not encountered before. So I think what we are seeing is this continued evolution where, as Greg said, we have to identify those specific tasks where the machines can keep humans safer or be more efficient, but still with that understanding that we can't take away, artificial intelligence to human intelligence and the fact of dealing with situations and applying common sense. So I think we're going to continue to see this rollout of very specific and safe limited applications of automated vehicles But again, the full automation, still has to have some type of human supervision.
Stan, when you made that point about humans are always going to be better about making decisions, I remember when I was a deputy director with the Kentucky Transportation Cabinet, standing at a barrier for a road that was flooded out, and a pickup truck came up, drove right around the barrier, and then drove into the flooded river, and then we had to go rescue them. So I'm going to say that it's a good point. Maybe can't go quite all the way across the spectrum, but I won't challenge your point that yes, humans can deal better with mostly with new circumstances. Susan, one trend that we're seeing here in the United States and around the world, and I think this is fascinating because it's clearly a reaction and a pent-up demand, but we don't yet know the outcomes. But cities like Seattle, New York City had started the trend of taking, sections off of Broadway and other streets out of traffic and turning them back to people and pedestrians and cyclists. And now Seattle's leading, Madrid, London. I think it's fascinating, and I'm just wondering, and this is actually open to any of you. I don't know that we yet know what the impacts will be on land use and development. So, how do we advise folks right now who are like, hey, I'm thinking about making big changes to my city or to my transportation network? What advice would you all have?
Yeah, I think what we're seeing with this movement towards slow streets and giving more rights of way for active transportation is really exciting. As we move forward, I think the use of data technologies will really help to inform this process, right? How frequently are these rights of ways used? I think we need to keep a keen eye, as we always have, for crash and collision data, which have often been a problem and quite elusive, as many of you know, in understanding what types of accidents have occurred. For example, in an area I do a lot of research, shared micromobility, it's really difficult to determine when you go to the hospital data, for example, which crashes are associated with those devices. In fact, Greg, I think you'll love this, I think maybe not love this, but I know you're a motorcycle guy, is a lot of those accidents get recorded as motorcycle accidents. Mm-hmm. So as we're looking at possibly shifting the streetscape, I think we have to think about not just public safety from a health standpoint, the transmission of COVID, but also the commingling of a lot of different devices, like an electric scooter or an electric bike. As you know, those can travel pretty quickly. And in fact, one of the interesting things that happened early on in the COVID shelter-in-place orders was that New York City actually allowed into its rights of way electric bikes, which it was previously preventing from occurring. And that's been exciting from a courier delivery type of perspective, but we also need to think about the safety aspects, particularly as the full-on, full-speed vehicles start to re-enter and to commingle. So that's one thing I'm concerned about. Well, I'm super excited about having more of that curb space and that right-of-way dedicated to active transport, which is what I think we should be doing, prioritizing bikes and peds. We also, I think, need to be really careful about the commingling of different levels of speed in those rights of way, and I think, collecting data could really help us with that, but also making sure that we start to understand better what the collision rates are and what they're associated with, including people being intoxicated, right?
Yep.
Yeah. Well, no, you hit the nail on the head there, because Greg is a motorcycle driver. So I've seen him tooling around. So actually, Susan, you raised a really good point, because here in Washington, D.C., Mayor Bowser just announced that all city streets will go to 20 miles an hour. And we've sort of always had this, saying in transportation, if you get hit and the vehicle is going under 25 miles an hour, you're going to the hospital. And if the vehicle is going over 25 miles an hour, you probably don't need to go to the hospital because of the severity of the impact.
Mm-hmm.
And yeah, that is something I think we're going to really have to understand. And I think that plays into a question that I think, this is a bit of a sensitive topic, but we've talked about, sort of closing streets, and transit and impacts. We've talked about telework, and that is a great option for people like me who are sitting at home right now and able to conduct this. But a lot of folks aren't able to do that, and I find that in transportation, a lot of decisions, particularly about transit, get made by people who don't rely on it. And we know that in transportation, while the interstate system brought us a lot of economic benefits, it also bifurcated cities and created, neighborhoods that were cut off from other parts of the city, and really reinforced a lot of, and maybe laid the groundwork for some of the unrest that we're seeing now. And so, from a research perspective or a technology perspective, what can we do? How can we, use technology to help increase equity in our system? One example I think of is using autonomous vehicles for food deserts and getting people fresh food options. But what are you all thinking about from an equity and access perspective?
Well, one aspect that we've been looking at recently is looking at broadband in communications actually as a mode of transportation, and seeing that in this situation, really seeing the stark divide between people that have access to communications and not. So we see this very starkly in rural areas, but we even see it very starkly in urban areas that don't have broadband access. They don't, a lot of us have had the ability to have a lot of the products we need shipped to us in real time at our homes. We've also been able to get education access a lot more quickly, and readily in, situations like this, having these types of seminars right at our homes. But for the people that don't have them, I think that's where we're seeing the great inequity. And so in order to address that issue, particularly as we see the rollout of 5G, we need to make sure that we have communications equity so that people are having access to the services and goods, and more importantly, having a lot of those goods and service accessible to them in their homes.
Yeah, this is something we do a lot of work on at UC Berkeley, and the work we've done, particularly on the use of shared mobility modes, so more of the public sector, private sector options, these either PPPs or just private sector deployments, indicate and have indicated for at least 10 years across a number of studies we've done that the people who use these services tend to be, by and large, in the majority, people who are well educated, upwardly mobile, and often Caucasian. And one of my personal frustrations as a pioneer, or I can't remember what you called me, but thought leader of something like this, right, is that when I first started to work on car sharing, one of the things that I thought was so exciting about it was this idea that you could give mobility and access to anybody, access to a car when you needed it, but be free of the hassle and the cost of ownership, right? Turn it into a variable cost. And so for years, I've been tracking sociodemographics. I've been looking at things, looking for, is this going to shift? And it became really clear to me that public policy needs to intervene to change this and to make these options more accessible to all, and that we really actually have to focus on this and work on it. And it's a real divide. It's both an income and a digital divide. And if we don't, I think, consciously work on this and see what people we are leaving behind, who they are, and understand what they want, this is going to just continue to divide us. And as we're seeing with all of the social unrest, there's land use divisions, Shaylin, as you mentioned, due to redlining practices that have been with us for about a century. we've really got to work on this. And I think mobile hotspots to help make sure that kids can study at home. Our friends in Sacramento have deployed some mobile hotspots with buses, which I think is a really neat innovation to try to make sure that kids can get online to do their distance learning. But, I have to say, I'm pretty passionate about this. We've got to work together on this problem because technology is moving really rapidly and we are leaving a lot of people behind.
Yeah. Oh, go ahead, Greg, please.
Yeah, I just got 2 quick points. Real quick, with respect to land use, I mean, for decades, road systems and city designs were based on population density, but that is anathema in preventing the spread of communicable diseases, right? So we're at a tension between what do we do with cities going forward if we know that these aren't the last pandemics we're ever going to see. And I've been reading some articles where, I'm here in the exurbs in College Station, but people are looking to leave the cities and come back to country living. They want chickens. They want to have their own farms where they can grow vegetables. So it's going to be interesting to see how this plays out going forward. And then the second point has to do with equity, and Stan and Susan certainly touched on this, but I wanted to take it one step back, and I'll compare coronavirus to Vietnam. So what's the touch points? Who got sent to the front in Vietnam? The poor and minorities, right? Overrepresentation of those two groups. So what does that have to do with COVID? Who got identified as essential workers, right? The poor and minorities. Is it really fair to say that grocery store workers are essential? I mean, they're essential to my convenience, but as Susan said, I'm amongst that cohort of folks that, is connected and, can work from home and has conveniences that, broadband and others make my life more tolerable. So, to put a brush, an equitable stain on this, we've got to be mindful going forward, as Susan said, that we're not creating powder keg situations by unfairly targeting those folks who can't protect themselves. And that really troubles me with respect to what we've been doing for the past 12 weeks.
Yeah, no, Greg, you're always pretty passionate what you say, and I can hear the passion in your voice on that. And it is something I think that we need to keep top of mind as we make these recommendations and have these thoughts about things. I saw a family on scooters the other day, and there were 3 members of the family on each scooter, and the safety person inside of me was like, that's not safe and probably in violation of the policy. And the father in me was like, what if that's their way of getting around as a family? And what would I do? And Susan, you talked about bringing in some of these other impacts, and somebody asked a question about healthcare. One of our members is Central Ohio Transit Authority, and Joanna Pinkerton is the director there. She talked about how in Columbus they're using healthcare data to see where folks are having negative outcomes from a maternity standpoint, and applying that to access to the healthcare system, and making sure that folks who may not be able to get to the hospital to have the necessary appointments are able to. And I think that is a real opportunity for us as we move forward to say, hey, there's a bigger world out there, whether it's, to be think. So are there applications like that you can think of where we could say, hey, here's a way for us to, whether it's healthcare or job access, where we can use technology and transportation to get people where they need to be?
Yeah, I have a project in East Oakland, California, in which we're trying to apply a number of specific use cases, access to jobs. One is one you just mentioned, Shaylin, which I'm actually really fascinated about, which is family transportation.
Yeah.
How do you get around if you don't have a car and you've got to move a large family? It's a problem, right? And access to jobs is also a problem, and access to healthcare and quality food. So what we've been trying to look at is, across these variety of use cases, what do these folks want, and what would help them when they need to move their family across the city for whatever reason that is, and what types of incentives or subsidies are needed. But I think a lot of times we presume that we know what the quote unquote solution is for populations that we don't understand what their day-to-day feels like. We don't understand what it's like to be rent burdened or to have just lost a job and have to make a decision between paying your rent and buying food and transportation. And so I just think we need to do a lot more on this and come up with the solutions like you're mentioning of realizing there's a disconnect between people being able to get to standard care when they're having a child, and that's a major problem. So, okay, let's go into the community and see if they'd be comfortable with an automated vehicle or a chauffeur driver. You know, how can we get them to go to these appointments? But I think this is like sociological kind of interdisciplinary type of work. And I think a lot of us work with a lot of technologies on this panel, but I think we have to become more multidisciplinary in trying to solve these problems, and also say, you know what, maybe we don't really understand what it's like to be in this person's shoes.
Yeah, I think that we often say that mobility is freedom, and for many of us, we have that freedom. And there are millions of Americans, whether it's because of economic challenges or physical, disabilities, that just we never think about it because we don't have to worry about if there's a curb cut or if you have access to get people in there. And what we often talk about, I think, sort of intelligent transportation 1.0 was talking about moving cars and trucks, and now we talk about moving people, data, and freight. And I think that's important. And we often and there's a lot of questions that have come in about funding. And I think we often get hung up on the cost of things, but I actually think we're not worried about the cost, we're worried about the price. So if that mother can get to a hospital and get the, prenatal care that she needs, does she have a better outcome, with her pregnancy? And does that then avoid other costs going forward? If we invest in active transportation and provide safe bike lanes and create technology solutions so vehicles can detect bikes and pedestrians, more people do that. We won't have as much public health spending. And if we can get kids to schools and they're not showing up hungry, will they have better outcomes? And do we create less of a problem going forward where we don't have to spend money on other challenges? I think we need to shift our thinking on this. So just from a funding perspective, what do you all see? The House T&I released the blueprints of a bill yesterday that ITS America thinks has a lot of great stuff. Senate EPW has released their blueprint of a bill. Again, lots of great stuff in there. What are your thoughts around funding as we sort of go in and know that there's going to be a hit, but recognize that technology provides a lot of great return on investment?
Well, I think a core policy issue, Jalen, that you just brought up was that, right now the agencies, if they're looking at their customers, the ones bringing in if the fuel tax is used as the revenue source, then they're seen as, okay, the customers are the ones who are driving vehicles. And so our whole system is kind of falsely focused on, okay, our customers paying the fuel tax are the ones driving the vehicles, and so the system becomes designed for that. So we need to be looking at the system as being holistic, not just for the vehicles. And I think as long as we keep basing our entire federal and state systems on fuel taxes, we're not going to be focusing on, again, moving people and moving goods in other ways that aren't going to be collected through fuel tax.
Mm-hmm. Yeah, there's a lot of shifting occurring across the U.S. in terms of thinking about, road user charges, which is essentially the user pays principle. And so, we're moving along in states across the country, and in terms of piloting programs and experimenting with these ideas. We're working really closely with the California Department of Transportation right now on their phase 2 road user charge program. And one of the things that we're on board to really figure out is, when you deploy something like a road user charge, can you do it in an equitable manner? so that it's not regressive. And so there's, I think, a lot of potential for road charge to be a more equitable tool. But our first analysis that we did on road charge 1 did suggest, when we did the modeling, that trucks, these heavyweight vehicles, right, that are potentially having many different types of impacts on society, right, they were actually paying the least relative to their usage of the road. So this is something that I think is going to be very complicated to do, but offers us an opportunity to sort of rethink, as Stan mentioned, the fuel tax.
Yeah, when Greg and I were at DOT, we called it VMT, vehicle miles traveled. And then when I went to be secretary in Delaware, we called it mileage-based user fee. And then when I went to Colorado, we changed it to road usage charge. We keep changing the name because it's not very popular, because people assume that they're going to get tracked. But I agree that VMT and getting off the gas tax, I think we're about 10 years away, and I think that both the bills that have been introduced or are going to be marked up will have a transition plan on that. Another piece, and Stan, you talked about this, electrification. So greenhouse gas emissions, I think, we all know that those need to come down. And so I think that electrification will have an impact there as well. What are some of the technologies or things around VMT or electrification where decision makers should be thinking about that and weighing in on that right now? And I don't know, Huei, if that's something that U of M is looking at.
Yeah, so not specifically for, say, mileage-based insurance or user fee and so forth, but we come back to one of your early comments. You said that we shouldn't be just looking at data as silos. We need to really think about why we are collecting data and what are we trying to understand. For example, we understand that the current the transportation funding is gasoline tax driven, and we know it's not sustainable. At this point, nobody's willing to raise it or revisit it. We really need to identify what is the question we are trying to answer, and then we try to understand what kind of knowledge or model we are trying to build, and then collect the data to help us not only to understand the current state, but also build a model to understand the future. I think a lot of the time when we are collecting data at, say, Michigan or Ann Arbor, we never really collect data just for the sake of data. It really always has a purpose behind it. So if we are looking at a sustainable future, certainly we need to worry about not just the internal combustion engine vehicles are paying for the tax, also the trucks, in theory, right, road damage is proportional to tire contact patch pressure to the power of 4, let's say. So trucks should pay more, right? Right now, unfortunately, of course, none of these decisions are made rationally based on facts or data or model. We really need to really start to rethink, okay, if gasoline tax is not the solution, then what is the alternative when we start to imagine a future that's not just thinking about road repair or construction? It's more broadly than that. It's more about mobility and accessibility.
So,
Mellon, I would
go ahead.
I would add, we've been fielding questions from legislators recently, trying to figure out how do we close the loophole so electric vehicles pay their fair share. So that's always been an optic. The other question, of course, that we just talked about is how do we ensure that trucks and heavy service vehicles are paying their fair share for the wear and tear they put on the road network. And then a third topic that I hadn't foreseen was, can you put some thought to what a road user fee looks like for all road users, pedestrians, bicyclists, scooters, they don't care, cars, trucks, right? So the question was, why are pedestrians et al. Deemed to be exempt from paying for the infrastructure that we are all using, right? So folks are getting pretty aggressive about trying to find sources of funding. And I just put that out there. I don't know if folks had heard that in their respective conversations or otherwise.
I had not heard tax the darn pedestrians. Greg, you know this, my favorite group is the Beatles. And I'm thinking of the Taxman, the song, you know, they'll tax your feet. Right? Hey, you know, in a revenue-starved environment, you know, there are no bad ideas.
Yeah.
Although I think again we want to balance impacts and other things. So we're getting close to the top of the hour. So maybe just to kind of wrap us up, I'm going to come to each of you, and you know, at ITS America we have a bunch of state DOT directors and city leaders that are either on our board, like Greg and Huei, or you know, tune into these things. So, you know, for each of you, I would just say from a technology research perspective, and we'll start with Huei, and you're on my screen. It's Huei, Susan, Stan, and Greg. So we'll go in that order. But if there was one thing that you would be like, this is what I think you should focus on, you know, what would that be? And we'll start with you, Huei.
I think data model, people talk about data a lot. They don't really talk about model or knowledge, but I think model is much more useful in the sense that if we just collect data and you look at the COVID-19, it interrupts everything. Ridership is down by 80% and so on and so forth, many other impacts. You don't really know, then you have nothing to help you to make better decision. So I don't think data help you make a better decision. It is the model, what if kind of scenario that help you to make better decisions. So if I'm making one comment only, it will be, don't look at data as if data is it. It is the knowledge, it is intelligence that we learn from it, and then how do we use it to make better decision going forward.
Yeah, we all talk about big data, but actually what we need is big information, because really, what is the data telling us? Susan, your one thought to decision makers.
Well, one of the things that's on our mind a lot right now is we're in wildfire season here in California, and we were really fortunate. On June 1st, so Monday, we received a grant to look at double trouble, meaning how do we manage for multiple crisis situations at the same time? And the reason I raise this is that I know a lot of DOT secretaries have to think about this, right? Because it's hurricane season. We've seen tornadoes. At the time I wrote that proposal, Shaylin, there had already been, and this, you know, I probably wrote it in April, there had already been 12 natural disasters that had happened across the United States at the time I'd written the proposal. So they were dealing with dueling crises at the same time. So I think we really need to think about, particularly as this virus seems to have a life, right? And we're in the early days of this epidemic. How are we going to deal with keeping our people and our workers safe on our transportation system in light of the fact that many states are going to be facing multiple disasters at the same time that aren't necessarily compatible? How do you shelter in place in an evacuation center and social distance? It's a really big problem, and many of you know that California had a very troubling wildfire season last year. We had many shutdowns, and many of us, including myself, lost power. We lost access to mobile technology. So how do we deal with the fact that we are not just dealing with a pandemic here? We're dealing with social unrest, and we're also dealing with natural disaster season. So lots of things for our state DOT directors to think about. And I think research and data and analysis can help with that.
Yeah, I think you raise a really a great number of points there. And in the most 2020 thing ever, Tropical Storm Cristobal, maybe hitting the Gulf Coast later this week. And my good buddy Sean Wilson down in Louisiana, I'm sure that's exactly what he needs to be thinking about. I mean, I remember when Kobe Bryant dying in a helicopter crash was the worst thing that could have happened in 2020. I live in DC. If Jeff Goldblum and Will Smith walked outside, I'd assume that it was Independence Day and they were going to fight aliens, because really, what else could happen this year? Stan, your sort of thoughts for decision makers now?
Well, Susan just stole mine, my perspective on resiliency, but I do think that understanding that a part of your resiliency planning as a city or township or state leader is now understanding that what happens to your system when people just don't use it. What happens to your revenues and what happens to your system. But secondarily then is this whole idea, I think, that everyone should keep in mind of the communications. Because again, if we don't have a communications infrastructure out there to our constituents in the states or the municipalities, they're not going to be able to access all of these great new technologies from, again, goods coming to them or them accessing healthcare and education and jobs. That's really the infrastructure, the transportation infrastructure of the future is a telecommunications infrastructure.
Yeah. No, I think that when we talk about infrastructure, we often think about roads and bridges. And I think that broadband for the 21st century is going to be the backbone that really allows us not to have a digital divide. And before I get to Greg, Darren Anderson has written in that TxDOT can share about pandemic, ransomware attack, and potential tropical storm all at the same time. Come on, Darren. That's why they pay you the big bucks. You know, just another day at the office. So with that, Greg, what would your thought be?
Well, I certainly agree with Stan about communications technologies. And since Darren's on the phone, he knows exactly what I'm talking about. We got 254 counties in Texas, but 25 plus have no physicians. So we're now talking about significant distances, particularly for trauma, heart attack, stroke, and trauma, injury in a rural setting. So, getting to healthcare, getting to trauma centers is out of the picture. So we need telemedicine. And, so that kind of communications, closing that communications gap is key and is significant. But I also remain of the mind that, we need to take as a transportation industry ownership for the hardening of assets against the spread of pathogens that's fallen between the cracks. We need to work multidisciplinarily, but there's no one no industry that's taken ownership of those human contact points and ensuring cleanliness as we entertain multiple passengers on public vehicles, as we move from user to user in the shared economy. We have to address that, or those ideas will not have an uptake in the future and going forward.
Well, look, I want to thank all of you. This has been awesome, and I think this is a great snapshot of what some of our leading universities are looking at, some of our leading brains, and I just appreciate you letting me tag along. And I would just close by, I think we define society as a group of people that share common interests and have shared connections or common objectives, and I think transportation underpins that for all of us. And I just appreciate the work that you're doing in this space, and let's keep thinking and let's keep doing, and please stay safe. Thank you so much.
Yes, thank you for the invite.
Thank you. Bye.
Good to see you all.
Thank you.